In this video, I'm gonna lay it all out. I'm gonna start sharing everything that I know about dry eye disease. Well, not everything, just all the main juicy, necessary information that you have to know to manage your dry eyes well. I'm gonna be thorough, I'm gonna be clear, and everything's gonna be organized. I'm gonna talk about the structure of tears, what parts of the eye are responsible for making tears, what the causes and symptoms of dry eyes are, and how to self-monitor your, hopefully, ever-improving dry eye symptoms, and to assign a numerical score to that process, what the role of blinking plays in dry eyes, and more. Hi, I'm Dr. Mike Vernon, and this channel is all about eyeballs. In my previous video, I spoke about the challenges you may have faced in getting good, actionable information on dry eyes. It's hard. I concluded that video by telling you there is an abbreviated list in that video's description about basic dry eye therapies. Did you get it? I'll put another copy of it in this video's description too, but I'm telling you now, in this video, I'm not going to expand on that list of basic therapies. I will in future videos. In this video is crucial for you to watch and understand so that later, when we talk about the actual therapies, and this is a promise and a guarantee, you'll understand them better, execute them better, and get much better results, because you'll not just be doing the therapies, but grasping why you're doing them too. All right, here we go. There are two important points that I drive home with all my dry eye patients at every visit. The first is that dry eye therapies work best when you do them regularly, without missing a day. The second is that it takes many weeks to months of consistent application for them to start bearing fruit, for my patients' eyes to start feeling noticeably better between treatment applications. Many weeks to many months, and when their dry eyes start to feel better, they have to continue to do the therapies in order for the trend to continue. Be consistent and don't break the habit of doing what's working. For best results, do the therapies every day, day after day, and don't stop for at least 60 days. If not sooner, then by the 60-day mark, I am expecting your eyes will start to feel better. But there's so much more to explain. Once you're done watching this video, everything you're doing will make so much more sense, and you should follow through with the therapies easier. Also, it's possible to quantify your dry eyes. You can get some measure of what your symptoms are like today. Usually in an office setting, a baseline of your symptoms is established. Perhaps your eye doctor has already done this with you. You can also do this yourself at home. You can complete a short questionnaire or two that quantifies your dry eye symptoms. There are more than a dozen dry eye disease questionnaires that try to quantify dry eye symptoms. Two of the most widely used are called the Standard Patient Evaluation Eye Dryness Questionnaire, SPEED questionnaire, and the other is called the Ocular Surface Disease Index, OSDI. There's a link in this video's description for each of them. With these questionnaires, now you can have some measure of your dry eye symptoms today to compare against your dry eye symptoms in the future. For example, in 30 days, you can take one or both questionnaires again, and in 60 days, you could take one or both questionnaires again, and so forth. If your score drops after 30 days and drops again after 60 days, and yes, when the scores drop, that means you're feeling better, then you can take some measure of confidence that your dry eye treatment efforts are working. In order to have a more meaningful discussion about dry eye disease, you have to have a basic understanding about the tears that coat your eye. You should understand the structure of the tear film, how and where the tear ingredients are made, and where the tears go after leaving the ocular surface. Understanding these basic facts is going to make you much more effective at executing the dry eye therapies properly. Now, most people know that their eyes make tears, they're moist, and that this moist, teary water is spread out over the surface of the eye. But tears and the tear film is so much more complex than that. It's made of more than water. It's much more elegant. The tear film is comprised of 3 primary components, or layers. The innermost layer, the layer that is in direct contact with the eyeball surface, is the mucin layer. The next layer in the middle is called the aqueous layer, and the outermost layer, which is in direct contact with the ambient air, is called the meibum layer. It's also called the lipid layer. But what the heck is mucin, aqueous, and meibum? Mucin is like mucus. It helps the tear film spread out evenly on and stick to the surface of the eye. Aqueous is kind of like what it sounds like it is. It's the watery part of the tear film, it's nutrient rich, and it's the thickest layer of the tear film. The outermost layer, the lipid layer, the meibum layer, is like oil. As the outermost layer, it's in direct contact with the ambient air, like I just said. So its primary role is to prevent the watery aqueous and mucin layers underneath from evaporating. It seals in and protects the aqueous and the mucin. Like I just said, of course, these tear ingredients are in constant production. So, where should the excess tear volume go once it's refreshed with new tears? It drains out through a little hole, or punctum, in each of the 4 eyelids. Each eyelid's punctum is located a few millimeters from where the upper and lower lids come together near your nose. Your tears flow out through the puncta down small tubules that eventually drain to the top of the back of your throat. Have you ever put an eye drop in your eye and tasted it a few moments later? That's why. Mucin, aqueous, meibum. What are the structures in the eye that make these ingredients? Specialized cells on the ocular surface called goblet cells make the mucin. There are hundreds of goblet cells spread out on the surface of each eye. The lacrimal gland produces the aqueous. Each eye has 1 lacrimal gland. It's above and towards the outside of each eye. Finally, meibum is made by the Meibomian glands. There are approximately 20 to 30 Meibomian glands in each of the 4 eyelids. The glands run perpendicular to the margin of each eyelid, and the little openings to the Meibomian glands are right along the edge of your eyelids. Goblet cells, the lacrimal glands, and the Meibomian glands are continuously producing mucin and aqueous and meibum, respectively. Goblet cells and the lacrimal gland secrete or discharge or push out mucin and aqueous all by themselves. However, to get meibum out of the Meibomian glands properly, they need help from your eyelids. Your eyelids need to touch each other in order to get the meibum to eject from the Meibomian glands. Each time you completely blink, in other words, your eyelids actually physically touch each other, that gentle pushing force that the eyelids put on each other causes a small volume of meibum to be ejected onto the ocular surface. As all 3 of the tear ingredients reach the ocular surface, they mix and naturally spread out into their 3 distinct layers. So what does the tear film do? Under normal circumstances, a healthy tear film accomplishes 4 important functions. First, it moistens the entire ocular surface. Second, it supplies parts of the eye with nutrition and oxygen. The tear film's delivery of oxygen, for example, is super important to vision. Take the cornea, for example. The cornea has no blood vessels. In order for it to get its oxygen, it relies on the tear film. The tear film gets its oxygen right from the air that it's in contact with. This is why we as eye doctors were always concerned with how breathable contact lenses are. Air has to permeate through the contact lens material, get absorbed by the tear film, and then finally oxygen gets delivered to the vesselless cornea. Okay, thirdly, tears include antimicrobial ingredients that fight off eye infections. Finally, a healthy and smooth tear film provides you with constantly clear vision without fluctuation. Can you imagine a caveman thousands of years ago without a functioning and smooth tear film? He could not have survived without one. A smooth, healthy tear film is vital to our entire well-being. So a smooth, healthy tear film is absolutely critical for seeing and feeling well. Any disruption to the production and delivery of mucin and aqueous and meibum to the ocular surface starts to throw the whole system out of whack. The ocular surface gets inflamed and unhappy, and you start to get blurry vision and irritated eyes. In order for the tear film to function properly, these three ingredients need to be in balance, or in other words, in homeostasis. Homeostasis is the condition that I'm always seeking to achieve when combating dry eye disease, and yet it can be such an elusive goal to reach because there are so many ways that a tear film can be thrown out of balance. There are two categories of dry eyes. The first category is the obvious one. When the lacrimal gland doesn't produce enough aqueous solution, then one is diagnosed with aqueous deficient dry eye disease. The second category is not so immediately obvious, but it'll make sense since I've described to you the three layers of the tear film. When the Meibomian glands become clogged, there's less outflow of meibum onto the surface of the eye. When the Meibomian glands become inflamed, the quality of the meibum is diminished. This interruption to normal Meibomian gland function is called Meibomian gland dysfunction, MGD. Having less meibum or meibum of poor quality creates a big problem. Since a layer of good and normally thick meibum seals in the water and the mucin layers underneath it, your eyes remain moist. However, without a good meibum layer, the aqueous underneath breaks down, loses its smoothness, and evaporates more quickly than normal. This is called evaporative dry eye disease. Now, you may be surprised to know that evaporative dry eye disease is more common, by far. Much less often, patients will have a problem just with their lacrimal glands not producing enough aqueous. 1 in about 8 cases of dry eye disease is only aqueous deficient. However, 7 out of 8 cases of dry eye disease is evaporative dry eye disease, or a combination of aqueous deficient and evaporative dry eye disease. If your eyes are dry, it's much more likely that your eyes make a normal volume of aqueous, but your Meibomian glands are stopped up. And what meibum that is ejected from the glands is of poor quality. Blinking is vitally important to maintaining a smooth tear film and a hydrated ocular surface. Let me explain to you how. A complete blink accomplishes 3 primary ends. In the first place, a perfectly formed tear film with all 3 tear layers vibrant and normal eventually starts to get spotty and evaporate. Usually, before a healthy tear film begins to break down and disintegrate, a blink replenishes it, respreads it, and smooths it all out. It takes a normal tear film about 10 to 12 seconds to begin to lose its smoothness and break down. The average time between blinks is about 3 to 6 seconds. However, the time between blinks can change depending on what we're doing. During an in-person conversation, your blink rate goes up to about 2 to 5 seconds. When we're reading or looking at a target up close or looking at our phone, our blink rate goes down to about every 10 to 12 seconds. Secondly, a blink causes a bit of meibum, like I said earlier, to discharge from the Meibomian glands. When a complete blink occurs, the eyelids touch, exerting mild pressure against each other. This action causes a small amount of meibum to be ejected from the gland openings along the edge of the eyelids. The meibum then spills and spreads onto the surface of the eye. Unfortunately, dry eye sufferers often blink incompletely. In other words, when they blink, the eyelids don't make contact. Even though they appear to make good contact, they often don't. Consequently, the outflow of meibum from the Meibomian glands is greatly diminished, and without a normal outflow of meibum onto the ocular surface, dry eye symptoms amplify. Finally, blinking pumps some volume of tears toward the four puncta of the eyelids next to the corners of the eyes. This pumping action helps drain the volume of the tears. As more new tear ingredients are made and added to the tear layers, blinking is also pumping away the older tears toward the puncta to drain away. Now that you understand the basics of healthy tears and the two general types of dry eye disease, let's talk about dry eye disease symptoms. How is a diagnosis of dry eyes made? In the first place, oddly, not everyone who has dry eye disease has eyes that feel dry. Some folks with dry eye disease will claim that they don't feel any symptoms at all. However, most people do have symptoms, and since you're here watching this video, I'm presuming that you're experiencing symptoms, that your eyes do feel dry. Besides feeling dry, there are so many other tools, techniques, equipment, observations, questions, and questionnaires that can be deployed to identify dry eye disease. Indeed, they are all helpful. But I have a rule of thumb when making a dry eye disease diagnosis. If your eyes feel dry, then they're dry. What do dry eyes feel like? Let's talk about these symptoms. What are the complaints? And wow, there are so many, but here are 12 examples. Burning, gummy, sting, sticky, excess tears, fatigue, gritty, light sensitivity, blurry, sore, redness, and pain. Unless dry eye is severe, it generally feels dry and or gritty and or irritating rather than painful. Dry eye is a chronic condition that starts intermittently and mildly and then becomes more pronounced over months and years. It's usually worse at the end of the day. In a windy, breezy environment, and that also goes for blowing car vents and overhead fans. It's worse in low humidity and after doing extended near work due to the fact that your blink rate goes way down, like after reading or especially working on the computer all day. Dry eye symptoms may not be equal between each eye. One eye may have more pronounced symptoms than the other, sometimes a lot more pronounced. And contact lenses can amplify all the previous symptoms, even if you're caring for the contact lenses and replacing them properly. Other symptoms may accompany dry eye symptoms that are not caused by dry eyes directly, but are often associated with dry eyes. Itchiness, crusty eyelids, and discharge can exist alongside dry eye symptoms, making dry eyes feel even worse. Itchiness can be caused by allergies. Crusty eyelid margins may be linked to a low-grade chronic eyelid infection, and discharge may be associated with a conjunctival infection. Dry eyes is often a condition that happens all by itself. However, it can be caused by a systemic disease. Those diseases are often autoimmune diseases and can cause general body symptoms like a dry mouth, swollen salivary glands, dry skin, aching joints, and dry eyes, to name just a few. Sjogren's syndrome is the autoimmune disease most often associated with dry eyes. It affects women much more often than men. If one has dry eye disease caused by an autoimmune disease, especially Sjogren's syndrome, then she or he needs to be treating the underlying autoimmune disease, and that'll help with the dry eye disease. Another insidious trigger of dry eye disease is medication. It can be eye drops and/or oral medicines. Glaucoma eye drops, because one must take them every day and almost all of them have preservatives, are notorious for inflaming the ocular surface and causing and/or aggravating dry eye disease. Habitually using Visine eye drops and other drops that get the red out can make your eyes more red and more dry over time. And there are lots of medicines that you may be taking orally that curtail the production of your tears. The categories of pharmaceuticals that are most culpable in inducing dry eyes are antidepressants, both selective serotonin reuptake inhibitors like Paxil and tricyclics like Doxepin, antihistamines and decongestants like Claritin and Zyrtec, hormones, pain medicine like Advil, antipsychotics, hypertensives like hydrochlorothiazide, birth control, acne medication like Accutane, chemotherapy medication, and gastrointestinal medication like Prilosec. Truly, there are a lot. There are far, far too many to list. And some dry your eyes out a lot, and some dry your eyes out just a little bit. The point is that if your eyes are dry and you take one or more of these categories of medicines, they may be contributing to your dry eye disease. Concerning your prescription medicine, please speak to your prescribing physician about the medicines you take in your dry eyes. Your doctor may be able to modify the prescription drugs you're taking so that your eyes don't dry out so much. Other triggers of dry eye disease include eating a poor, body-inflaming diet, especially one low in vitamin A, aging, especially if you're over 50, having a history of eye surgery, particularly LASIK, and contact lens use, especially overuse and/or not caring for your lenses properly. Men get dry eyes, that's for sure, but women are more susceptible to dry eyes than men. Hormonal changes in women amplify the likelihood of experiencing dry eyes, like taking birth control and being pregnant and going through menopause. Whew! We have covered the basics of tear film structure. We've discussed the eye anatomy that supports the tear film structure. We've talked about some of the causes of dry eyes, and you've taken a moment perhaps to complete the SPEED and OSDI questionnaires that quantify your dry eye symptoms. Now we've arrived at another crux of our discussions. With a greater understanding of tears and eye anatomy and dry eye disease in general, we're going to go for a deeper dive into the therapies. Now please remember, no matter the category of dry eye you find yourself in, no matter how dry your eyes feel, starting therapies sooner rather than later is in your interest. In other words, treating emergent to mild dry eyes is easier and less expensive than moderate dry eyes. It follows that moderate dry eyes is easier to treat than severe dry eyes. The sooner you get started implementing these therapies and forming these habits, the more likely your eyes will feel better lubricated and will stay feeling better lubricated. Now that we've gone over all this information about dry eyes in detail, it's time to expand on the abbreviated outline of dry eye therapies that I've included in this video's description. In the next videos, we'll talk about 11 home-based therapies for dry eyes in great detail and with additional expert tips and product recommendations. See you in the next one, and thank you for your eyeballs.